This is an aide-memoir for me, and it's largely to divide them up. But equally, it illustrates reasonably well what is actually happening. And although what that shows is A&E admissions to Scottish hospitals between 1996 and 2004. Let's take the 0 to 15 group. And the message with that is a very optimistic one, actually. Underage drinking is falling, and it's been falling pretty much steadily now again for the last 10 years. And I think that's basically all I'm going to say about that. Generally, if there are people who are drinking heavily at that age, it's a reflection of a whole series of other problems. It's not just alcohol. So, as a really quite optimistic message with young people's drinking at that level is it's come down, and it's come down quite considerably. And we were at one point one of the highest young consumers of alcohol for young people at that age in Europe, and now we're about middle now. Although we've got 16 to 24, it's probably quite handy to divide that up into 16 to 18. The 16 to 18-year-olds, again, is a really interesting group. There's been a big shift in how they drink. They probably drink more frequently than I did, but they drink less than I did. And what is happening with this group now is that this is another group, the 16 to 18-year-olds, who on the whole are drinking less. And again, that's a trend now. It's 10 years, 12 years, but that's been going on. We think there are two things that are happening, is that parents are taking a much greater role now in supervising even teenagers. We know that a sort of, not exactly supervisory, but sort of monitoring role, setting a model of responsible drinking and within the family is a really effective way of preparing kids for later on. Because also what the other thing that seems to be happening is that we know kids, yes, 16 to 18-year-olds, they will occasionally drink with us at the table and we'll have a glass of wine or whatever it is they want. But more often than not, they drink with their families, their friends rather, and their peers. But if we there's good research that if we have inculcated with them a sort of sensible drinking message, sensible behaviour message, they tend to adopt it in their own behaviours, which is, I think, a shift, because yes, you get some binge drinking in that group. You'd be lying if you didn't. But what you don't get very often is repeated binge drinking. They tend to learn pretty quick that you don't carry on doing it. So again, that's quite an optimistic message. That this is a group again that is tending to drink less than it was 10 years ago. We then got to the group 18 to 24. You can probably move it up to about 30 now. This is the group where traditionally we've drunk at our highest. That now is narrowing between the older age groups. So that gap, there was a big gap, now it's becoming a much narrower gap. Because it was thought that in the old days you matured out of heavy alcohol use because it was less available and it cost more. Now the general feeling is that we don't get this drop-off of consumption after 30. In fact, this is the group where it stays stable and it seems to be going up. But what we're seeing, and we don't quite know why, and some people might have seen papers that can sort of put an explanation, but we're seeing the largest fall is in the group now between 18 and 24 to 26, those sort of age ranges. And we think this is largely to do with lack of money. If you think about if young people can get work, it tends to be now compared to previous generations, poorly paid, part-time, contract-based, minimal employment rights. So that's a whole shift, and which we don't know yet. I've not seen any evidence that does make that link. But it seems fairly clear. We know that there is a big link between price and how much people drink and disposable income. And the other thing is that young people are often having to pay very high rents on places now. They just don't seem to have the money to spend on alcohol. And the other thing we don't know yet is the impact of tuition fees and loans, because often people coming out, if you don't get a job, you're having to start paying that back. So that's a hunch, but I suspect the reason why we're seeing that fall may be because of a cultural shift that says, well, actually, we don't really want to be drinking in the ways that our generations above us have done, but it equally may be a function of just money. And when we get up, that 25 is a bit unfortunate now, that if we get from 30 onwards, we slowly but surely keep it having much more stable patterns. They're not falling off. And I don't know if you saw last week that there was national statistics data and that said that over the age of 45, compared to below the age of 45, you're much more likely to drink every day. And again, that is probably, let's just say it's a function of a huge cultural shift generally, but equally by then, you've got more money. And the research has shown us that if you've got more money, the higher your disposable income, the bigger percentage you're going to spend on alcohol, which I think probably explains why you've got the fall off from young people, because they haven't got the money. The other groups have got more money and have continued to drink at the same levels. And this is the group that are much, much more resistant to a message that says, yeah, actually it's time for you to cut down your drinking. I could speak quite a lot about the elderly, but I think that is almost like a lecture in itself. But the elderly are a group where we're also seeing increasing consumption. And I think the message from that is what you could possibly drink quite comfortably when you were 65. By the time you got 70, you may not be able to do so because your body is not as effective. And often the other thing is that there's a very, very fair chance you might be on a whole load of other prescription drugs as your body gets less efficient. But that's about 20 minutes in itself talking about the elderly, so I'll move on from that.